This morning, we're taking some time to talk about maternal mental health in Utah. We know almost half of expectant and postpartum moms experience depression, anxiety, and Utah is trying to do a little more to help. Governor Spencer Cox just declared February as Maternal Mental Health Awareness Month. Pretty awesome. And First Lady Abby Cox shared her story. She struggled with postpartum depression with her third baby. So it's just so important for moms to know that anxiety and depression around pregnancy, treatable, in a lot of cases preventable. Joining me this morning to talk about how Brooke Dorff, a specialist with Maternal Mental Health Utah. Brooke, thanks so much for being here.
Yeah, thank you.
I really appreciate it.
Yeah.
So I am about 9 months pregnant myself. I have found your guys' resources during my pregnancy, and just an incredible amount of content you guys have created for Utah moms.
Thank you. Yeah, it's been really great. So Maternal Mental Health Utah is part of the state health department, and it started because we found out that Utah is one of the states that has the highest incidence of depression and anxiety during pregnancy and postpartum.
So we know that this is, as we're saying, treatable, even preventable.
Mm-hmm.
Can we walk through that? What does that treatment look like?
Yeah, so I mean, medication's an option, therapy's an option, but what we like to tell people is to get help before you even think you need it. Mm-hmm. So because almost half of Utah moms go through this, you probably will. Mm-hmm. So know your resources, know where to go get help, join a support group before you hit rock bottom. You know, there's a lot of things we can do to prevent it.
Right. Can we walk through, what's the difference between postpartum depression and like baby blues? That's something we think of a lot.
Yeah, great question. So baby blues don't last longer than 2 weeks postpartum. That's like a really important marker.
Okay.
But another thing is that with baby blues, it's overwhelming. You feel kind of like, what am I doing? What's happening? But the predominant mood is still joy. You can still do stuff. You can still live your life, take care of yourself, take care of your baby. Mm-hmm. If it lasts beyond 2 weeks, or if your mood feels overwhelming, or like you feel like you can't get out of it, then you know that it's time to seek help.
Are there any other symptoms you would have women look out for, maybe symptoms that are just not really talked about among women?
Yeah, anger is a huge one that nobody talks about because it induces a lot of shame. That's a huge one. The number one red flag we tell people, though, is if you or your partner, your spouse, say, I don't feel like myself anymore, or you're not acting like yourself anymore, whether it's overeating or undereating, or oversleeping, undersleeping, irritability, any of that, then it's time to get help probably.
Got it. Okay. I'm so excited to talk about your guys' referral network. So this is something you've been working on for a couple of years now. The legislature has put funding towards it, and it's incredible. It's really amazing. What is the referral network? Can we talk about it?
Yeah, so it's an interactive map. It's maternalmentalhealth.utah.gov, really easy to find. And you can search for everybody who's been trained in maternal mental health on this website. So therapists, support groups, your OB, if they've been trained, they're listed on there as well.
Amazing.
And it's all throughout Utah, and you can find help basically from anywhere because a lot of people are doing telehealth now.
And you can also search by insurance provider.
Yes, which is huge because a lot of people can't pay for help.
Right.
So you can search by either Medicaid or no insurance if you have no insurance or can't pay for it. And the free resources will be listed there.
So cool.
Thank you.
I'm working on finding a pediatrician. This is the first place I'm going to find a pediatrician because it's so cool. You guys also, your social media game's so strong. Can we talk about your Instagram really quickly before we have to go?
Yeah, it's just Maternal Mental Health Utah, and we talk about all types of education on there, things that we think are unmentionable or moms don't talk about that make everybody say, oh my gosh, I'm not the only one. So Maternal Mental Health Utah on Instagram and Facebook.
I have been following your guys' Instagram for a while now. So fun, also so useful. Brooke Dorff with Maternal Mental Health Utah. We'll have all of this listed on our website, abc4.com/GMU. Brooke, thanks so much.
Thanks, Sarah.